First and foremost, good evening to all our panelists and everybody who is watching at home, either on Zoom or via our Twitch stream. And welcome to the Health and Wellness Departments and Health Disparities Town Hall. My name is Luis Larios. My pronouns are he, him, ed. I am currently a third year studying pharmacology, and I'm the alcohol and other drug health promotion intern at Health and Wellness. I have also helped put out several messaging for health and wellness regarding COVID-19, and will be one of the moderators for tonight's town hall.
Hi everyone, my name is Arzu and my pronouns are she, her, hers. I'm a third year biology student, hopefully applying to med school in the near future. And I'm also the internship coordinator for the Department of Health and Wellness and part of our COVID-19 committee. And I will be helping moderate alongside with Luis and Jane tonight. Jane, would you like to introduce yourself?
Sorry about that. Hi, I'm Jane. I'm a health promotion intern at Health and Wellness, and I specialize in sexual and relationship health. I'm a fourth year sociology and feminist studies major, and I'm graduating in like 2 weeks. So I'm so glad to be here with y'all tonight. Okay. And then before we commence, we wish to acknowledge the traditional custodians and all land upon which the university is located and pay our respect to the Chumash elders, past, present, and future, for they hold the memories, the traditions, and the culture of this area, which have become a place of learning for people from all over the world.
Thank you, Jane. I would also like to read to y'all our health and wellness diversity statement. So our health and wellness mission is centered on the behalf that a community thrives when the perspectives and voices of all members are recognized, is valued. Diversity includes, but is not limited to, ability, age, culture, education, ethnicity, gender identity and/or expression, nationality, race, religion, sexual orientation, socioeconomic status, and veteran status.
As Health and Wellness recognizes that students and staff come from various backgrounds, as stated in our diversity statement, the purpose of this town hall is to begin a dialogue of the current issues and disparities that are being highlighted as a cause of the current pandemic. So with this town hall, we really hope to gain perspective from students and professionals to better serve the needs of our diverse student population during this pandemic.
Furthermore, we recognize that issues highlighted in this town hall are not all new and have been public health issues for centuries. We hope going into the future that we can implement programming to better serve the needs of members within these communities to help influence a change towards seeking a health equity status and addressing health disparities.
And before beginning this town hall, we would like to acknowledge that our panel is not 100% representative of all marginalized populations in the UCSB community. We really made it our best effort to reach out to members of communities highlighted in this town hall. However, unfortunately, not everyone was able to attend. And we still decided to go through with the town hall in order to initiate this important conversation in our community, with the hopes of continuing this conversation in the future through more events just like this town hall.
Okay, we'd like to start off the night by establishing some ground rules. To begin, please appreciate the diversity of perspectives. All perspectives are valid. This town hall style was designed to support learning together and the creation of a shared understanding of how we collectively see this topic. Maintain a respectful space. Everyone is deserving of respect. We ask that we treat each other with kindness and respect. And we invite you all to participate with intention and share what you think in a diplomatic manner.
And now to just go over some of the logistics of how the town hall is formatted. So all participants have been automatically muted upon entry, and we kindly ask that you use the chat function down below to comment during each portion of the discussion. After each discussion section, there will be an allocated amount of time for participants to ask our panelists questions. So please type your questions into the Q&A box, and Louise, myself, or Jane will read them to the panelists.
Questions can also be asked anonymously. There will be a survey link in our chat box for feedback, as well as for participants interested in continuing the conversation or helping us achieve our objective. And I'll go ahead and drop it in the chat right now.
And now we will be introducing our wonderful panelists for the evening. First of all, we have Dr. Ali Javamput, Medical Director of Student Health Services.
Hi, everybody. Glad to be with you. I've been in this job since June of 2015. I'm an alum from class of 1993, so really excited to be back on campus and glad to be invited to this group.
Next, we have Dr. Laura Polito, Associate Medical Director of Student Health Services.
Unmute, there we go. All right, hi everybody. As he said, my name is Laura Polito. I am the Associate Medical Director here at Student Health Services. I've been in this position since July of 2019, so it's been a super interesting first year here at UCSB Student Health. But one of the things that I most appreciate about being out here at UCSB is actually stuff like this, where students like you guys have really taken the initiative to address these super important topics. So I really appreciate you including me. It's really an honor to be here. And I also appreciate the shout out to veterans as a veteran myself. So thank you for that too.
Thank you. Next, we have Dr. Melissa Smith, who's the Director at Health Equity Initiatives at UCSB.
Thank you so much. I'm a family medicine physician, and in addition to working at UCSB in the direction of health equity initiatives, I also work in a health clinic in Santa Maria, taking care of primarily indigenous Mexican farm workers, and have been involved in a variety of health equity efforts over many years, and I'm excited to contribute to these efforts here on campus.
Before continuing on, we also have a survey link that Dr. Melissa Smith requested that we drop in the chat. Dr. Smith, do you want to talk a little bit more about that before we move on?
Sure, I can say more later, but one of the things I do is co-teach a course on community-based participatory research on health inequities, health disparities, and we now have a student project that is supporting the Immigrant Health Rapid Response Task Force that's focused on COVID-19. So we have an active, dynamic group of students working with us, and this is a survey link to invite other students to let us know if you're interested in either participating as a volunteer or potentially doing an independent study this summer, as we will be planning new ongoing projects. So I can explain more about that later. Thank you.
All right, thank you. All right, our next panelist is Dr. Jason Protowski, who is an emergency medicine physician at College Hospital and the coordinator of the INT 75 Underserved Medicine course.
Yeah, thank you, Liz. Sorry I'm a little bit late. I was figuring out how to log in. Jason Protowski, I'm a local emergency physician, and I'm the medical director for Santa Barbara City Fire Department. So I do a lot of work with public health locally and disaster response. I'm the coordinator for the Underserved Medicine Seminar, of which Melissa was a speaker for. And I also am the academic coordinator for the Medical Humanities program. So it's a real honor here to talk to our academic community about disparities in health and health inequities. Thank you.
Thank you, Jason.
Thank you. Next up, we have Dr. Mario Barfield, who is a psychologist at UCSB Counseling and Psychological Services.
Good evening, everyone. Thanks for allowing me to be part of this important discussion. I'm a huge believer in sharing ideas and sharing wisdom and just talking about things that are really, really important in our communities. And this is absolutely one of those things. And so, though it's been a long day, I'm absolutely happy to be here and looking forward to our conversation. So a little bit about me. I've been on campus 7 years. I'm privileged to be a psychologist in the counseling center on campus. I provide mental health services to the general student body at UCSB, but one of the things that I'm primarily tasked with is supporting the overall well-being and specifically the mental health of our Black students on campus. And I do that via individual services. I co-facilitate with Dr. Meredith Merchant a support space for Black graduate students. I co-facilitate a support space for Black men on campus, and also do a little bit of contract work with Black students down at City College, which I started last year. And so really just happy to be of service to students and happy to be a part of this panel.
Thank you. Next, we have Dr. Sharon Tediga, who's the director of the Center for Black Studies Research and professor at UCSB's Department of Black Studies.
Well, good evening, everyone. I'm really excited about being here myself and being able to see a diverse group of individuals. It's a little bit exciting, but also intimidating in some ways. But I am here at UCSB for 2 years, but I'm not new. I actually did my graduate work here in psychology and educational psychology. So I've been around the block a little bit. Prior to coming here, I've been a faculty at other institutions, and I won't name them. But I'm excited to be back home in many ways. I'm a native Californian, and it's great just being back at UCSB after 26 years. So I'm excited to be here and work with everyone. Thank you.
Next up, we have Michael Takahara. He is the health education specialist, specifically in positive psychology, and also teaches our Education 191W class for the Department of Health and Wellness.
There we go. I will echo Dr. Sharon that I was kind of nervous because I'm like, I'm not an expert on health disparities, but I am also excited to be on this panel with everybody here and to hear from our students and whoever else is joining as well. Because my intention on being on this panel and all the work that we do is to try to make this world a more equitable, a fair place for all people, where they can be treated with dignity, respect, and love. And I feel like, even though I don't know all the answers, being part of these discussions is my way of sharing my experience, my thoughts, and learning and listening and trying to make a difference in that way and putting myself out there. So I'm grateful to be here today. And thank you for putting this on again to our students.
Thank you for that, Maka. Next, we have Jacqueline Ovalle, who is a health education specialist at the Department of Health and Wellness, and she specializes in food, nutrition, and basic skills.
Hi, everyone. My name is Jackie Ovalle, and I'm really happy to be here today. One of the reasons why I am happy to be here is because this is such an important conversation that has been going on for a long time. I mean, since the beginning of time as we know it, and now it's really highlighted as we're seeing COVID-19 unravel, and I'm just so happy to be a part of this discussion. Really looking forward to just hearing everyone's thoughts and sharing my experiences, like Maka said as well. So thank you all, and I will be sharing a little bit in terms of my experiences with food insecurity and my nutrition programming as well. Thanks.
And last but not least, we have Professor John S.W. Park from the UCSB Asian American Studies Department.
Hi, good evening, everybody. I'm John. I've been teaching at UCSB since about 2002. I'm not exactly sure why I was invited to this particular thing. Mostly I write in legal history and I write in immigration law and policy. Yeah, and I guess it's the immigration angle, or maybe it's the Asian American angle. But I'm very pleased to participate in the panel, and I'll mostly be listening. And in about an hour or so, I'm going to cut out and feed my family, because this is what this is what happens in these strange times that we're in. But very pleased to see all of you.
Thank you for that, John. And thank you to all of our panelists for being here and giving us a little insight on why you're here and a little bit of background information on yourselves. Now we'll be moving into our first discussion topic, which is racism against Asian Americans. And just to provide a little bit of background information on the issue, according to the Asian Pacific Policy and Planning Council, there has been an increase in reported incidences of remarks as well as reported racism against the Asian population in the United States.
In the past, viruses have been named based on their geographical location. And President Donald Trump has nicknamed the virus the Chinese virus. Why do y'all think is it essential that we promote the use of the virus named COVID-19?
Well, yeah, I mean, it's just for the reasons that Lewis mentioned, is that the spike in hate crimes and the spike in acts of intimidation against persons of Asian ancestry. I mean, when the Secretary of State and the President of the United States talks in that particular way, they're doing what the sociologists would call racialization, right? I mean, they're racializing something that essentially is not, it doesn't really have a racial identity, and yet and I think they're doing it for very self-serving reasons, because they don't want to talk about their own incompetent behavior or their own inadequacies. They're going to have to bully it and racialize it in that way, and I think that's just so deeply unfortunate. Yeah, and I think it has had very negative consequences on lots of Asian Americans throughout the country. And just it certainly isn't helping foreign relations either. Yeah, and I'm very concerned about these kinds of things as they happen on our campus, right? And on our campus, it's many of our students, as you all know, are international students. They are from China, and on the one hand, they are some of the more privileged young people in China, because their families often do have the means to send them to study abroad and to find institutions like this one. And yet, in light of the pandemic and the way in which our political leaders have talked about the virus, these students went from being relatively privileged, happy, people who are studying in the United States, just being targets. Yeah, and I just think that is just horrifying to live in a time when we have our political leaders talking in that way, and just so irresponsibly. And yeah, and I do wonder, from my colleagues who are more familiar with and have greater exposure to students on campus and are counseling them, what the impact has been. Yeah. So I'll stop there. I mean, I'm really interested in what you are all have experienced.
Is it okay if I was supposed to raise my hand? I'm sorry. Is that okay? I mean, I just think, simply put, it's problematic and divisive language, right? It's a divisive label. And I think we live in dangerously divisive times. I hope that goes without saying right now. And I think placing an inaccurate and problematic label like this just reinforces a lot of things that have been longstanding problems in our society. Xenophobia, I think of cultural ignorance. I think it increases this kind of like this misguided fear that people have about certain groups of people. I think it promotes negative stereotypes, acts of violence against those being targeted. And I also think it reinforces a Western kind of individualistic lens for trying to kind of think about and conceptualize this pandemic, right? And I think that's dangerous, because I think it's exactly the opposite of what we need to be focused on during this time where we need to be figuring out how we can collectively put our energies together to support one another and really address this pandemic the way that we're capable of. And so I think when language like this is being, used by those in charge of our political systems, that's a far-reaching platform. And I think it's, dangerous. Someone used the word irresponsible. And it's really, it's frustrating, and that's probably simplifying it for myself, but those are just a few of the thoughts that I just wanted to put out there really quickly.
Maka, then we'll go to Jason.
Just to answer John's question, a couple of things. One is in winter quarter, the Office of International Students and Scholars and EOP and the MCC, I believe, put on a program for COVID-19 international students to come and talk about these issues. It was kind of early. We weren't in shelter in place at the time, but students said that they did not experience at UCSB at the time any direct xenophobia or racism, but on their social media for their friends across the country, they had seen those things happening at their universities and their experiences. When we sat with the students, I think one of the powerful things for me to hear for them was just the humanity of this whole thing, right? That they had family back home who they were trying to convince to put on masks, right? That they were like, no, Dad, you have to put on a mask, And they're like, no, it's going to be okay. This is early on, right? And the ability not to go home because of the travel ban and to feel kind of helpless this side of the world, trying to worry about all those people, feeling guilty that they couldn't be there to help out during this time. And the other thing I think is even now when you see it, whether you experience it personally or not, when you see it in the news and you see it on the internet and you see these things happening to people, it affects us, right? It affects us, and we can't ignore it in the sense that it hurts, right? And yeah, I don't know. I mean, I'm glad we're having this panel, but one of the things I wanted to say is just in the last day, right? We had Christian Cooper who was trying to walk and watch birds, right, in Central Park, be called by the police to say there's an African-American man and totally using that kind of violence to intimidate him. And then just that same afternoon, George Ford, right, just screaming on this video saying, I can't breathe, and I hurt all over. And when I think of health disparities, I think that this is systematic racism, right? Systemic racism. And so where does that come? We have to address the whole big picture of racism. And we have to do it collectively as a whole people. So I'm kind of rambling. That's what I have to say.
The only thing I'd add, I mean, we have scholars here who have a far better understanding of the underlying sort of history and structural violence in our nation. I'm an emergency physician who, as a public health student, studied traumatic injuries, traumatic violence. And when it comes to the COVID-19 pandemic, I looked at the numbers. I looked at the data. And when we think about Asian Americans, there's two things to think about. Is that there's no doubt about that by giving this virus a name that targets a particular ethnic group, emotionally ties into underlying fears and underlying emotions. When you look at the public health data in the United States and in the UK, where there's a lot of other Asian immigrants, there's no doubt about it that the incidence of traumatic injuries, we're talking about assaults, stabbings, shootings, beatings of people of Asian ancestry, goes up, especially after various political statements. And that's measurable. So these are the things we can measure. What bothers me as someone who looks at public health data is what I can't remember what my colleague, Professor Park, commented on, is the unmeasurable. Back in the winter when I was teaching underserved medicine seminar, I had a couple of Asian American students come up to me and say, Dr. P, I'm kind of scared. And we have, I mean, this is a pandemic. Uncertainty is the norm. We're getting hit with information from all kinds of which ways. None of us know what is real and what's not. People are already scared. And that takes a psychological toll. And I know we have psychologists on this panel that can talk with far more authority than me. But we've yet to see the toll that the social media used as an instrument for racial discrimination, plus the stares people get when they go to the grocery store, plus the names people are called when they walk down the street. What kind of emotional toll does that take on people? Here we are, and we're only in month 3, right? I mean, in COVID land, it's like dog years, right? We're only in month 3 of what is really a long war against the virus. What kind of psychological, substance abuse, and emotional toll this is going to take on people who already have the same underlying social anxiety of uncertainty that everyone else in the world has about this virus.
Dr. Laura?
Back with the unmute. And then just to tag on that, I think that one of the things that is not quite as obvious as maybe the, the blatant, racism that you see is sort of the long-term, really insidious effects that you see down the line in things where, I think absolutely the best example of this is how the fatality rates and the life expectancy for people of color is just, the fatality rate is higher, and their life expectancy is lower for exactly the same, economic groups, and exactly the same professions, and the same neighborhoods. And Venus Williams is a great example of this. When you have that insidious sort of messaging of this person is an other, and this person is not as much as you, that's how you end up in that situation. And so I think that something like, a leader and then other people standing up and saying, oh, this is the Chinese virus, that's where that starts. And so you need to call that out at the beginning.
Can I say one other thing is that I think that we're going to have to, if we reopen as an institution in the fall, in one way or another, we're probably going to have to bake this discussion into orientation, right? We're going to have to, there has to be a post-COVID-19 orientation where we bring our young people together, and some of it will be virtual, some of it will be in person. But I'm hoping that we can work toward teachable moments, right? So the last time that an American president, or the first time that an American president referred to Chinese people as though they were a virus, that was Rutherford Hayes. I mean, this is like, it's so depressing that we have to orient our students to listen to those kinds of messages from the political leaders of the United States and say, wow, that's late 19th century overt Chinese exclusion racism, right? And but I think we're going to have to do that, and I think we're going to have to do that across a range of issues in light of what this virus has brought. Yeah.
Thank you, John, for that. Dr. Sharon, I see you have your hand up. Feel free to go ahead.
Yes, I just want to jump in on this last part because a colleague and I happened to, we were writing a paper on healing, talking about healing methodologies, because a lot of the methodologies that are developed are very Eurocentric, and for people of color, we have a very different, we often have different epistemologies, right? So one of the things that really struck me as we started to write this paper, because they were talking about the healing methods and developing this model, and I stopped to think, what does it take to heal? It takes rest, right? We need to rest. And that's what our bodies need. Even when our bodies are healing, it needs rest. And often as people of color, we don't have the opportunity to rest. So how can we heal when we're constantly bombarded with all these negative and violent aggressive behavior, whether they are micro invalidations or microaggressions. So when will we ever have time to heal? And this is historical. So how can we heal psychologically when we're constantly being traumatized by everyday events? And I just wanted to put that out there because I think it's something that we have to think about even when we bring the students back to campus. What does healing mean when they come back to campus? How will we address their needs around the traumas that they've experienced of the COVID-19, much less traumas that they even had before because of, structural racism. So that's my comment. I have other things to say, but I'm going to wait till later.
Thank you for that, Dr. Sharon. I think that's a great gateway into our next question. Jane, do you want to present that?
Yeah. So about 75% of our international student population is from the People's Republic of China. Looking at the report provided by the Asian Pacific Policy and Planning Council, about 40% of the 1,700 reported incidences of racism against Asians was here in California. How do we as a community help rid the stigma that some people believe that there is a relationship between Asians and or Asian Americans and COVID-19, when in fact we know that there's no correlation?
Okay, well, it may surprise many of our younger people and even maybe some older folks who are newer to California, but yeah, California was a center of Chinese exclusion in the late 19th century. And so, in some ways, racism and violence against Asians is as Californian as, the state itself. I mean, the origins of the state and the history of the state, it really begins with violence against Native Americans and their displacement, and then violence against Asians. And in some ways, it's a peculiar violence in the sense that white folks who inflicted that violence, they themselves were quite new to the state too. They themselves just got here, right? And they assert a kind of white supremacy against that. So I think, again, like when we have students coming in from China, when we have students from California at UCSB, it is a teachable moment. I think this is a unique moment because even on the one hand, we might be worried about violence against Asians. I think one of the more interesting things that I found about the pandemic is that it's kind of exposed that other white privilege, right? Like people who feel like they don't need to wear a mask, they don't want to shelter in place. They want, don't touch my gun kind of people in Michigan who are going to say, I mean, that's kind of fascinating in a way to see that resurgence of a very open form of white supremacy. I mean, it's just terrible, but at the same time, it just underscores how many younger people are these issues are gonna be around for a long, long time, right? And part of coming to the university is becoming a more educated citizen. And that's the kind of work I think that we have before us, yeah. And it's overlaid with all those public health issues that I think that Jason and Mario have talked about psychological issues and then just kind of the drain of living in the society. But yeah, I mean, Jane's original question really makes me think about how we might have to situate young people, instead of seeing these phenomena as things that are new, rather things that are old and recurring patterns in American history.
Thank you for that.
Which, if you think about it, is even more depressing. I mean, even as I'm talking about it, it's exceptionally depressing.
Yeah, I agree. We'll go to Dr. Ali and then Sharon, you can go.
So for me, when we're talking about the medical response to it, it's a matter of unlinking a public health disease and an infectious disease from an association with a certain race. And so the more consistent we are, at least on the medical side, of using the terms COVID and talking about testing and tracing, there's going to be a lot of that talk going on. I think that can help to reinforce the message that we're talking about a virus and it has a name, and that's the name that we use it. And we're not linking it to any other ethnicity. And I think at least the medical community, County Public Health, California Department of Public Health, CDC has done a really good job of staying with that message. And hopefully, as we continue, we can be that consistency, can kind of start to set the tone more, and we can move away from those who try to make it more racial and more divisive.
Well, in connection to what you just mentioned, Ali, I do have a question then. I understand the need to try to keep the disease itself, the virus itself, neutral. But when you have higher incidence of certain groups dying, it's hard to kind of disconnect the problem, the systemic problems that are already existing. So I'm just wondering, how do you highlight those things, right? Because it's important, because we really have to face the fact that we have a lot of health disparities in the United States.
Yeah.
And we have to really, we have to deal with the fact that some of it is income, some of it is race. It's the intersection of many of these things. And you can't just take this virus and say, oh, there's no connection between these things, because there is. Because we see,
I think if anything, and it's exposed a lot of inequalities by race and class.
Yes, it has.
Yeah.
Yes.
Terrifying. And even if it's not racialized, I think the other thing is, I'm talking too much, I'm sorry. But the other thing is like, I think after this pandemic ends, we must have some serious discussion about how human beings in general interact with animals, with things that can potentially cause us to become gravely ill, and global pandemics, just the way we engage in industrial forms of farming, or way some people have to eat animals that are really dangerous. I mean, that they are vectors, they carry viruses that are very deadly, and a combination can really kill you. Yeah, I think we have to have some serious discussion about that. And I do not have enough expertise to know exactly how to do that in a completely sensitive way, right? And without pointing fingers and devolving in the ways that we have more recently.
Mm-hmm. Well, John, don't you think that that's definitely an economic issue?
Yeah,
right?
I think so.
I mean, so we have to deal with, again, inequality around economics and capitalism.
Yeah, I mean, both for something like Ebola, and then for the coronaviruses, MERS and SARS, and and COVID-19, a lot of it was driven by just abject need, like people who had no other way of eating, and being forced to come in very close contact with animals that were very, those were the origin of these pandemics.
I kind of want to make a quick comment, because the conversation is drifting towards that like 200,000 pound elephant in the room, which is the incredible disproportionate impact this pandemic is having on specific populations. Mm-hmm. And, I think we could probably just have an entire panel talking about the impact it'll have on Asian American students as we move towards reopening in the fall.
Yeah.
I think that the big part of this discussion, what I like to do as a public health person and as a clinician, is to look at the science, look at the numbers. And then once you look at the numbers, which are not controversial, right? These are, they're clear. The numbers, you got to go where the numbers take you. The numbers are not controversial. And then start asking the questions, okay, why is it that African-American populations have a much higher transmissibility and a much higher mortality in every single American city? Why is it that this is decimating the Navajo Nation, but not suburbia, white suburbia? So let's just have a quick kind of a public health crash course. When we're talking about this virus, and we're not going to talk about race for 1 minute, this virus is transmitted by droplet transmission, okay? And in public health, we talk about how contagious a virus is by its R naught, okay? Which is, you have one infected person, how many people are they going to infect that person to? Now, if you are in a poor minority population, your ability to physically distance is impaired. You are living in high population density, whether we're talking about low-income housing, jail, prison, skilled nursing facilities, whether you're talking about the east side or the west side of Santa Barbara, where you have low-income immigrants, lots of people densely populated into one-bedroom apartment, okay? This virus will spread like wildfire in those populations. So when we're talking about the spread of the virus, if you are low-income, minority, for a variety of reasons that a lot more people understand this better than me, based on historical, political, social context, you're likely to catch this. That's just the reality. That's not open for for debate. That's the science. The next component is mortality. If you catch this virus, how likely are you to end up in an ICU or dead? Okay. And when you look at the risk factors for ending up in an ICU or dead, obesity, diabetes, high blood pressure, chronic lung disease, COPD or asthma, inadequate access to healthcare, meaning you don't have health insurance, you don't have access to a clinic, or probability of ending up in an ICU or dead goes up dramatically. So now we make this huge social leap that why is it that African Americans, Latinx, Native Americans, undocumented immigrants are so much higher risk for ending up in an ICU or being dead? Whether you're looking at New York, Detroit, New Orleans, the Navajo Nation, Los Angeles, Santa Maria, right? And these are the numbers. So next, you have to go to the next question is, now wait a second, why is it that African Americans in our country are so much higher risk for morbid obesity, diabetes, hypertension, chronic lung disease, living in low-income, densely populated housing, being in jail or prison where they're going to be high risk for exposure? Look at our Lompoc Federal Penitentiary, right? And I think that is the question that this panel is supposed to get to. And I think you just have to kind of get the public health and science out there. And I think you also have to give the disclaimer that there are a lot of people that don't believe in any of those facts I just said. They're like, hey, no, this virus is caused by 5G towers based on a deep state conspiracy from Bill Gates, Anthony Fauci, and the Pope. You know, and if you're not even going to believe on these facts that we're talking about, then, you know, we're not even having if we can't even agree that the data we're collecting is accurate, then we're not even having a conversation anymore. But I think you have to recognize that there's tremendous misinformation, and that there really is no controversy that this virus disproportionately is more contagious and more lethal to ethnic minorities in our country. And what they're also finding, if you look at the data in the UK, it's also the same. If you're Black in the UK, if you are an undocumented immigrant, if you immigrated from Central Asia, Southeast Asia, or Africa, your likelihood of ending up infected and dead also goes up high. So I think that's like the next staging point to the real important meat of this conversation. I'm going to mute myself because Melissa's about to say something profound.
I don't know about that, Jason, but just to build on what you said, I kind of think of it as three really important factors that are complementary with what many of you have already said. The whole concept of proximity, and not only living in housing dense situations, but think of who our essential workers are in the country, right? They're low paid, low wage jobs that are primarily filled by communities of color. So you've got your postal workers, the people who are cleaning the hospitals, the farm workers, and so on. So these are our essential workers, but they are the ones who are proximate. They are at greatest risk of being exposed. The second one, that is sort of building on the concept of underlying conditions, thinking about the importance of the idea that where we live, work, learn, and play impacts our health. So all of the conditions, the chronic conditions that make people of color more likely to get seriously ill, diabetes, asthma, heart disease, it's because they're living in these in communities that are completely impacted by lack of access to those social determinants of health. And then the final and most critical thing, which many of you have already alluded to, are the upstream factors. So all of these social determinants of health are caused by these upstream, long-standing policies and practices that are a manifestation of institutionalized racism. And so I think it's really important to just get everybody thinking about structural causes, thinking about those institutional factors, and then that really informs change. So, and that I certainly hope we're going to have time to talk about action and change, because I think what we need to do is really be thinking about especially the role of our students and our future leaders to impact policy and impact those structural factors.
Just to kind of bring things back to sort of the schedule we have on hand, a lot of y'all made some really good points and touched on a lot of subjects that are actually on our next discussion topic. Just if anybody has any closing remarks based on the topic of racism against Asian Americans. We had one more question, which was what brings upon the need to blame a group for the virus at all? I think you all touched a little bit about it, but if you want to make any closing remarks, then we'll go to Q&A for this part of the discussion. Jason?
I'm just going to make one quick remark because I feel like I'm already talking too much, is that when you look at the history of infectious disease, the big pandemics that have swept through the world and have changed the way our society acts, oftentimes there's a scapegoat. And to kind of quote Professor Park, this is an incredible teaching opportunity for us to re-examine. I mean, like he said, this pandemic has pulled back the veil and showed us for our healthcare system, our education system, our urban planning, every fabric of our society, that just the generations of structural violence, racism that it's built upon. And we have an opportunity to expose it and to potentially begin to rectify it. I mean, the Black Death in the Middle Ages was the end of feudalism. Mm-hmm. That was the first time that workers were able to say, you know something, we're plowing your fields and we deserve a living wage. And that was the silver lining. And I think we as a society need to be having these active conversations and bringing it back to calling this the Chinese virus or calling Asian Americans a virus in and of themselves, just how damaging that is to the fabric of our nation, and to start having these conversations about, okay, well, wait a second, what can we do as a nation so that when we emerge from this, which we will, when we do, we can emerge from this stronger and as a better society.
I think that reference to the Black Death, if there's one volume I would recommend to all of you, it's Norman Cantor's In the Wake of the Plague. And the last chapter is about the burning and killing of Jews. That in the wake of the Black Death, that many of the peasants and serfs who improved their position often did that at the same time as they were murdering large Jewish communities in Europe. Again, finding a scapegoat. Right, it's a chilling read. It's just, I don't know that there's something in us as human beings that we often do that kind of thing, where we find scapegoats and we just blame them for these things. And of course, in American history, there are numerous examples of that, right? That racializing Asians, racializing Native Americans, and so forth. So I really do hope that Jason and Melissa are right, that we can turn this into a teaching moment to expose these horrible patterns and to address them for the next generation of students.
What Maka?
I just wanted to say two things. One is another part of this health disparity, and I was just listening to NPR this morning, and they talked about testing locations and neighborhoods in Texas cities, for example. So like in Dallas, in the wider parts of the city, they had 22 places where people could go and get tested. And the less white people of color communities, they had 7, right? In El Paso, it was 13 for the white communities and 5 for the people of color communities. In Austin, it was 16 places you could be tested, and so on, 9 inside of people of color communities. And so there's also, again, this sort of, I'll put it in the chat so people can read it themselves, this this systemic racism that's happening on that level. The thing that I will address John's question, like what else can we do, or maybe your question, Luis, is that when I went to talking to our international Asian students again, one of the things that they said was really powerful for them during that meeting was that from the administration, they got an email from the chancellor, right? They got an email from the vice chancellor of student affairs. They got an email from the director of international students and scholars. They got an email from EOP, and so on. So if we are going to make this a more a safer place, I don't know, a safe place, but a safer place for our students, regardless of what background is, it needs to come from everybody. Our faculty need to be saying something when they put stuff up on Gaucho Space. They need to talk about it in their classes when they introduce the class. It has to be repeated, right? Our staff need to do that. Our administrators need to do that. And then everybody needs to keep on talking about this continuously.
Mm-hmm. Yeah.
Thank you, Maka. Dr. Smith, you have your hand up.
That was a mistake. I never put it down.
Okay, thank you. Dr. Ali, you also have your hand up?
Sorry. Yeah, not a whole lot. The points that I was going to point out were already made, but the other aspects that we talked about besides housing density and the kind of work that people do, the other one's transportation. Communities of color and people of color have to use public transportation more. That's going to put you at high risk of getting infected. And then there's, of course, the economic cost of not having health insurance and being able to pay for medications. And so, yes, a lot of stuff that we talked about. That's all.
Okay, thank you. So we'll be moving on to the Q&A portion. So if any of the attendees have any questions, feel free to drop them into the Q&A box. I'm not seeing any right now, but I do have a question. John, you mentioned that there should be sort of an implication for COVID-19 related material in orientation. How do you think we should go about doing that and accomplishing that, and maybe speaking to administrators to get that implemented within the short time span?
Yeah, I think that they have their hands full right now. I don't think that we're going to be fully normal by any means, right? So some instruction will be remote, some will be in person, and we're not even sure what that's going to look like. So I'm sure that the administrators are completely trying to figure out how to do that. And then for students, we're not even sure about, like, are they all coming back and populating the dorms? I mean, among my, Jason, you're, a dorm must, residential halls must seem like a public health nightmare in a crisis like this, right?
High population density, shared eating.
Oh my goodness, right?
It's like the Diamond cruise ship.
I know, it's like cruise ships on land, and it's just, if the patterns of illness and things persist in the same way, I think that many of our, I've often wondered, and this is like a terrible sick joke, and I'm sorry for the sick joke, but I've often wondered, like, and it was in light of the shootings, I've often wondered whether one of my students might shoot me. But then now, I have to wonder about whether one of my students will infect me, right? So even as the virus flows around residential halls, many of our faculty colleagues are older, like, we have underlying conditions and so on. So I just don't know how that's going. So in reply to, how do we do this at orientation? We should start planning as soon as possible. Like, we should try to get ahead of all of these things as soon as possible and adapt to what I think will be at least 2 or 3 years where we're going to have to deal with this virus.
I think, the way it was best put to me was my good friends, the Doc Sachs, put it this way. It's the hammer and the dance. We have a new virus that is contagious and lethal and disproportionately affects people who are older and people with other medical problems. And when it first hit, you have to throw down the hammer. We don't know a lot of information. We need to lock down. We need to gather information. We need to understand what it is we're dealing with so that when we're ready to move forward, we do so safely with the safety of our students and our faculty in mind. And now we have 6 months of data, which in the world of public health is not that much.
Yeah,
but 6 months of data, so we have some idea of how this virus transmits and what it can do. So now we do the dance. And the dance is you take a couple steps forward, and then you take 3 steps back. And you take a couple steps forward, and then you take 8 steps back. And we're going to do this until we have a vaccine that is safe, is effective, is readily available, is mass produced, and our population's willing to take it. And that's going to be a few years. You know, I mean, all honestly, I mean, we're looking at 1 or 2 years. So we're going to do this dance, and the dance is going to depend on a lot of data, and the data is going to depend on testing, which, you know, Michael had already commented on. Some people have much more access to this test than others. And for those of us in clinical medicine know that the test is not 100% accurate. You know, there's some limitations on the test. And it's going to depend on populations of vulnerability, that as long as we have densely populated groups of people who are susceptible and vulnerable, where all you need is one case to cough or sneeze in that group, then they're going to light up and you're going to have another little epidemic, and then we're dancing backwards again. And I think for the students who are wondering what's going to happen, the honest answer is, you know, continue to be resilient. Decisions are going to be made fast. We're going to have to adapt fast. And we're going to have to, this is going to be our new norm, is to live with a certain degree of uncertainty, but to do so mindfully, knowing that UCSB still continues to breed the most brilliant, creative, innovative minds of the future. And we still have to do our due diligence to do that, because the next pandemic that comes, and it will come, I mean, history is what history is, you know, the person that's going to understand how to deconstruct the structural violence that has wreaked havoc on minority communities may be one of our undergrads. And the scientist that's going to come up with the vaccine for the next pandemic may be one of our undergrads. And we have to continue to work with the tools we have and control the variables we have.
Thank you, Jason. Dr. Ali, I see you have your hand up.
Yes, just to build on that. So let's say when we do get a vaccine, when we do have a treatment, how is that going to be distributed? Who's going to be the first people to get that vaccine or to get the treatment? Is it going to be those people who are really high risk, who live in those densely packed areas, who have to use public transportation, who work in sanitation and delivery and grocery stores? Or is it going to be the lower risk, well-off suburbia people who have better health insurance? To really get that effective treatment to the people who are high risk and need it the most, you really need some good, strong, central leadership to set that intention. I don't think we're going to have that nationally. So really, I think our best bet here is to look at it locally on the county and the state level, where I think there is hope to have some kind of central intention to take hold of it and get it to the people who need it the most, rather than letting the free market give it to the wealthy. So as far as us and what we can do, I think engaging with our representatives, at least on the state level and county level, I think has some potential.
And we can vote to make sure that that happens.
We kind of, to bounce off what Dr. Ali said, we have a question from one of the attendees. They are asking, what are some ways we can effectively disseminate public information to communities who have high populations of non-native English speakers? Through this time, they're thinking specifically of their parents, grandparents, and relatives who don't speak English at all. Dr. Smith?
I mentioned that I'm working with the Immigrant Health Rapid Response Task Force that is specifically focused on reaching out with public health information to Spanish-speaking and Indigenous language communities in the county. And for the people who are from Indigenous communities, primarily in Oaxaca, most of their languages are not written. So what we've been doing, this has been a wonderful collaboration between the Santa Barbara County Department of Public Health and an organization called MyCOP, the Mixteco Community Organizing Project. And CAUSE is taking the public health information and putting it into short videos where people are now, they've translated it into multiple languages, and also made low literacy flyers where people can see things in that format. And so that's a really effective way to do that. The other thing I'll say is that I work with an organization, Hesperian Health Guides, that produces low literacy health information in 85 languages. And you can go on their website, hesperian.org, and look for really great flyers about COVID in many languages.
I would probably piggyback on that, is that there are some very innovative public health minds that are taking public health messages to unconventional places. And before this pandemic. I know that there was a NDMPH, I think in Atlanta, who would go to different barber shops in African-American communities to talk about high blood pressure. I mean, we're in a fight. This is a two-fronted war. We're in a fight we're a three-fronted war. We're in a fight against a virus, racism, and misinformation, right? And you have to fight misinformation with creative, innovative tools. And maybe some of the young people who are attending this call have some ideas on how to get the best and most current, accurate public health information into the families who are already very distrustful of governmental institutions for a lot of very legitimate historical reasons. And how do we get that information, whether it's a language barrier or a cultural barrier or a distrust barrier, to get that communication effectively and to be able to adapt, to continue to change the message as the message changes with new information, is something for young minds.
Dr. Mario, I see that you have your hand up.
Yeah, I guess I just wanted to piggyback off Dr. P and a couple other folks. Because what I'm thinking about is this idea of, effectively testing accurate information to the communities that absolutely need it, to the communities that have disproportionately high rates of impact of COVID-19. And I think it's a great thing to be able to get a virus to those communities and to those individuals who it's a little difficult to connect with. But I also think about some of the barriers in terms of the skepticism. Like I think about in the African-American community, there's a lot of skepticism around folks like myself, medical providers, right? And Dr. P, I think, as you said, appropriately so, historically, Black and brown bodies, people with intersecting identities have not fared well in terms of medical treatment, mental health treatment. There's been a lot of misdiagnosing, there's been a lot of inaccurate information, and there's been a lot of experimenting, abusing of bodies and minds. I think about like scientific racism and all of those things that historically have caused people who are underrepresented to be very skeptical about services that could be beneficial to them. And so I think, okay, when we do have a virus that is working, how do we partner with community liaisons? How do we partner with maybe political leaders who have authentic connections to some of these communities in a way so that we can build rapport, and build trust and really continue to undo some of the unfortunate things that have happened to folks who absolutely need these services. Yeah, I had another thought, but I think I'll just pause there. That was just something that I was thinking about in terms of.
Thank you. Dr. Sharon?
Yeah, I guess I just have a general question for everyone here, because one of the things that Mitch Stripling claimed, he said, one of the problems in the United States is that we're organized, we're unifying, we have a unified information ecosystem that's acted in a very chaotic fashion. How do we deal with the operation in terms of this chaos that we've created? Because a lot of information is going out. You talk about information, but at the same time, I've heard a lot of misinformation. I have followed very, very closely the National Academy of Medicine and all of their webinars, as well as the American Association of Public Health. I've followed every single one of those webinars that they've had. I've been in on the talks, listening to what they had to say. And then I look at Santa Barbara County and Ventura County and what the representatives have said on their websites, and the misinformation that we've been given. We were some of the last, I think, in California. My husband is a nurse, and I can say wholeheartedly, they did not provide with him the necessary PPE to protect him. And this is California. This is Santa Barbara County. And I'm like, this is a serious health problem here. We're having some problems here. We're talking about it. And we're talking about getting information out. And of course, again, on one of those other webinars, Gaio, the CDC in China, that's one of the things he said. The most critical thing that you need is get that information out. So how do we really get the information out, knowing that we are chaotic in the way we're addressing this issue? There has not been a lockdown or shutdown. We've consistently ignored it. Whether it's, I see people in the streets all the time. So how do you get that information out? Because we're assuming that the information, number one, is correct. And I've seen a lot of misinformation and people don't want to acknowledge, like with my husband going into his facility, they're taking temperature. We know a lot of people are asymptomatic. So why would you engage in certain behaviors and get that information out? That's really wrong information. So that's my question to those of you in the medical. And I, of course, pose this question every time I'm with medical people in healthcare because it's a problem.
I think that you're asking all the right questions, and recognition of the problem is one of the first steps to resolution. And I think there's still a lot of people in our local and national community who don't even acknowledge that this misinformation exists. We live in a world where people get their information from social media, and you can watch a YouTube video with real scary music in the background about all kinds of conspiracy theories, and then that goes viral. And meanwhile, the good work that Ali and Laura and Melissa are doing with their community outreach, is falling to the wayside because they don't have professional editors for their YouTube videos. You're absolutely right. And we are, the United States is, again, this is a question not for a clinician, but for some of the social scientists on the panel. We are a fractured, fragmented, polarized society. And it shows because we
Yes.
can't even agree on what the facts are.
Yes.
Here it is. I just gave a rant that this is caused by a virus that originated in China in December 2019 that is contagious by droplet and can cause all of these respiratory lethal complications. And I can't get people to agree on that. People are still telling me, oh, it's not worse than the flu. And I'm like, no, you're that's inaccurate. But the question is, to bring it back to what Mario said, is when you're talking about disenfranchised communities, whether you're talking about communities of color or communities that are disenfranchised because of their political beliefs, which could be, quite right wing, they're not going to believe. They're not going to believe a scientific elitist like me. I went to all that school. I'm just trying to manipulate and exploit them and trying to sell them something. I'm part of the deep state conspiracy and in Big Pharma's pocket. And I don't know. I mean, in order to gain that degree of trust, so that we can get a unified message, the way that when you look at some of the countries that do it well, like South Korea. How do we get a unified message to health providers, to the captains of industry, to the leaders in the community, who can help then influence everyone else in the community to believe that this is a virus that deserves respect? And I say this in all my community outreach: the minute you disrespect this virus, it will hurt you or someone you love. This virus deserves consistent respect all the time, and just because it went into hiding and it retracted for a little bit doesn't mean it's not going to be back. And how do we get that information to people is really one of the big questions that I think you nailed it on the head. Like how do we get consistent information, and as the information changes, how do we get the new information to people is one of the big challenges of public health.
Thank you, Dr. Prstowski. Laura, I'm going to let you go right now. After that, we do have a couple more questions that were saved towards the end, and then we'll move on to our next discussion topic.
Okay, I'll keep this super short, I promise. Sharon, I thought that was an excellent question and really goes so many layers into what's going on. But I think that in order to start to think about, like what Melissa brought up earlier, like what do we do to move forward and make definite change going forward, I think education is going to be a huge, huge part of that. In a lot of ways, we're lucky because we're in education. When you look at the national education, it exhibits many, many of the same problems that healthcare does, and that communities of color don't have the access to education that wider communities do. But I think that that we're at a really unique position at a university to be able to start to educate people on the multitude of issues that are going into something like this, and how it's not, yes, it's the virus and it's a huge, huge problem, but there's so many other factors coming into this that we're here to talk about tonight. And the inequalities in education are something that could have its own separate panel for, for hours and hours and days. But yeah, I think that's a great place to start. And when we start to talk about where to go from here, I think education's a great place to start.
Great. Thank you for the wonderful conversation. I truly appreciate the dialogue. We're not going to be moving into the health disparities in underserved communities. As many of you have mentioned, and just to give a little bit of background, health disparities in underserved communities have been highlighted as a result of this pandemic, but these health disparities are nothing new. Dr. Anthony Fauci actually gave a statement that says, we've known literally forever that diseases like diabetes, hypertension, obesity, and asthma are disproportionately afflicting the minority populations, particularly African Americans.
And, I think we see that it's said that the virus does not discriminate, yet we are really seeing the highest incidence reports in Latinx, Black, and Indigenous communities. So I guess the question we're posing is, why do you all think this is so?
Dr. Sharon?
I had just a little bit statistics. Jason, you mentioned statistics, and we might as well bring them up. And this focuses on the African American community. If I can, I need to be able to share my screen though. Luis?
Yes. Are you able to?
I can't do it. You have to click on the share screen multiple.
Hold on. Can you do it now?
Yes.
Yes. Okay. Perfect.
Yes. Thank you. Let me just go here. Sorry. Well, one of the things that you guys all talked about, and this comes from, NBC News, quote, being Black is still bad for your health, right? Racial disparities for Black Americans, heart disease. And we know that that's been one of the #1 killers in the Black community. And I just want to talk a little bit about the health inequalities and structural racism and what has happened and has been going on for a very long time. One of the things that came out, what we know that's needed, and those of you in the public health know, this is from the annual reviews from the CDC, this is what we need for equity in healthcare that we seem to just keep falling short of, particularly in communities of color. And I'm not going to spend a lot of time, I just have a few minutes. When you look at some of the leading cause of death in the Black population from 2017 CDC, you can see for both male and female, it was heart disease, right? I mean, that was, and it, to some extent, it probably still is. And then one of the things that's problematic is when you look at, this is from the Kaiser Family Foundation, the poll that they recently took, that people are really concerned about having healthcare. It's been a fundamental problem in the past, and they have it broken down by income. As you can see, 71% is really important to them. When you look at the other distributions of high income, it's not as important. So we have these inequalities even around that. Again, of course, I think as you mentioned, Laura, someone mentioned that if you're wealthy, then you're not going to care whether or not you get the health care that you need. Then when you look at what is happening right now in a lot of the communities, you can see that due to the coronavirus and its impact, it's had a huge financial impact where people are skipping meals or they're relying on charities. And this is and you can look at the distribution around race and ethnicity to see the certain percentages that people, what's happening with our community. And I wanted to talk about the effects of this COVID-19 because that's what it's talking about now. Let's leave away the heart disease and talk about what's happening with COVID-19 that you guys have so pointed out. what matters, right? This was in the Washington Post around incarceration. You mentioned that, I think, Jason, about the incarceration and what's happening. People are concerned about many things around this. These are the social factors, right, around the COVID-19. Look at the crosses. You know, this is a perfect example. Louisiana, that's had a high percentage of Black people. People are just burying people. I saw the same thing in Brazil. You know, you guys mentioned about, you know, Black people in communities in England. But what is happening to Black communities, I wonder, in places like in Africa, where you have a high percentage of Black population, where there's not a presence, a presence of Europeans? What's going on in those countries? I know about Ebola and the statistics around that and know what the results were, but I'm not sure what's going on right now with Blacks in these other countries. And looking at comparison, what are some of these factors? Is it completely, you know, I mean, other than the virus itself and the virulence of the virus, is it really about stress and predisposed conditions, and as well as the epigenetic aspects of it and what's happening in this country and other countries where, you know, Blacks have been exposed to these many, you know, hundreds of years of stress. As you can see, 13.5% of the US population are Blacks, 25% are, you know, COVID-related deaths now, and that's climbing. You can look at the different age groups. This is for all groups in terms of per 100,000. This is, again, this is APM Research Lab. I pulled these statistics from the internet. Then when we look at the different states about the number of cases that they actually have, we can see that the majority of the cases are in the South. Then when you look at the number of deaths, they are also in the South. And then when you even look at, Wyoming or places like that, they have very few Black people, but I guess the ones that are dying there are Black. It's just really interesting. And finally, I look at Santa Barbara. I pull these statistics. This is all from the Johns Hopkins map on what's happening in Santa Barbara County and the numbers of people, and you can see the distribution of white, Black, Asian, American. You talk about statistics, here they are. And I think that's something that we need to discuss on why are we seeing these. We know some of the issues, but do we see these same issues regardless of what country they're in? If it's Black related, if it's related to economics, what's happening in Haiti? The last time I looked at Haiti, and in terms of the number of cases that they had versus the deaths, it wasn't that high. And we're talking about really crowded conditions and poverty, one of the poorest countries in the world. So I really wonder, and I'd like for you guys to just respond to that and the statistics that I brought up around this. And these are people that are concerned about their physical health. So I got a little data on the physical health. Again, pulling this from the Kaiser Family Foundation. It just came out. On what COVID has done. You have some that feel like it's gotten worse, it stayed the same. So as you can see, most people think it stayed the same because they've already, especially talking about people with health problems, they already have them anyway. And they don't feel like it's gonna really make a big difference. 4 in 10 people worry and stress. They're getting a lot of stress over it. So this is the mental health part. We have a lot of problems again. We already have problems with stress. And of course, when you're a student on campus, you have a high incidence of stress and anxiety, makes it worse. And then you have faculty that also have stress. It's affecting everybody. And I don't think we've dealt with even the information around stress and what's happening in the people of color community. I've had so many students right now, I'm teaching. I have 200 students in a class, and they're all very concerned about just their everyday living. And then we also have the lower income households. They've lost more money because of Corona, right? Women, urban communities, look at the difference. They've had a negative impact on their mental health. You know, they have to worry about many things. So we have to deal with the disease itself, and then of course the results. You mentioned social science. Here's some social science data. These are the percentages of people that are skipping meals, Blacks, Hispanics, and lower income household. And these are the states that are reporting the race and ethnicity. Some states are not, some states are reporting it. So that's the other thing. Why aren't some states reporting it? Some people are messing with their numbers because they don't want to report these things. Again, this is information. So I will end with that. I wanted to present that, and let me stop sharing for us to just talk about this a little bit.
Thank you for that, Dr. Sharon. Jackie, I see you have your hand up, so I'll give you the mic for now. Dr. Sharon, they're also asking if there's a way for you to share your slides, perhaps
Absolutely.
in the chat. That would be great. Thank you.
I can pull them. I got lots more. I told you I've been on every single thing there is. So it's crazy. I've become obsessed. Maybe that's my mental health.
Well, thank you for sharing that, Dr. Sharon. So I just want to jump back to the original question really quick and just touch briefly on one of the many aspects that Dr. Sharon brought up, and that is regarding skipping meals. And so I just want to say, like people have said before, this is a really layered, complex issue. I mean, we have things like systemic racism that is reinforcing the wealth gap. We have lower wages. And then we have our essential workers who lost a lot of work because they can't go and, let's say, clean that house, or they can't go to the ballpark and, you know, pick up after people, or they can't go to the gardens and do their work. Whatever it is that they're doing, there's work that was lost. And so now that means that there's more income that was lost. And now when it comes to paying for things, are they going to pay for their gas or their bus ticket or their rent, or are they going to pay for their food? And that's a big question that we're seeing, right? So how are we getting the food? And so now I'm thinking a little bit more about food insecurity and how it was already a severe issue with a lot of these populations we're talking about. And now it's just really highlighted, right? The veil has really come off. And so also another thing to consider is everything is costing these populations money. I mean, a lot of them live in food deserts, which is basically not having access to nutritious or reliable source of food, right? You go to maybe primarily African American or Latinx community, and the closest grocery store is like, I don't know, a CVS or a pharmacy or something else, and they have to go miles. And now, do they have a car? Are they getting on the bus? I mean, there's so many implications there. They can't really come back and stock up on their food. They have to continuously expose themselves to the virus, and now bringing it back to their condensed communities, living with abuelita or with grandma. You know, there's just so many things going on there. And then additionally, a lot of these students, like their children, let's say K through 12 or even college students, relied on the food that they were receiving at the schools. And this has a really big impact on their ability to succeed in their academics, which further feeds into their ability to acquire some of these higher paying jobs. And so it's just one big cycle. And sorry I ranted on for a while, but I just wanted to just really shed light on how it's one big circle and it's systemic, and it's going to take a lot of effort from many angles.
Jason, you have your hand up.
Yeah, the only thing I would add to Jackie is those food deserts that she's talking about. She's talking about layers. Those food deserts also add to diabetes, morbid obesity, which also causes worse outcomes. Those are the ones that that we'll end up taking care of in the ICU. So, you know, layers upon layers upon layers, just absolutely.
We'll go Dr. Smith and then Dr. Laura.
I really appreciate everything you said, Jackie. And as I've said before, really also like to highlight solutions and inspiring action that can be taken. There's a wonderful West Side Food Justice Initiative that's evolved in Santa Barbara that has lots of folks working together, getting it to complement the food bank resources, getting food from local farms to families on the West Side who need access to fresh fruits and vegetables. They've gotten funds to plant a garden. They're doing a community garden, and they've really mobilized this whole kind of mutual aid collaboration on the West Side. So I think as we think about these root causes, we really always need to be thinking about solutions that can be, that we can do together. So, thank you.
Can I add to Melissa's comment really quick?
Yes, go ahead.
Yes, thank you, Melissa, for mentioning the solutions. And yes, I very much am on the solution-oriented train. And as a matter of fact, I just want to do a shameless plug here. One of the many things I do is coordinate food nutrition and basic skills at UC Santa Barbara. And that is a take on food insecurity or promoting food security through education. And so that's helping students stretch their dollar. We teach them skills like how to grow their food, how to access food, how to cook with whatever pantry items they have. And now that we're doing online education, we're trying to be even more mindful of that, thinking about long shelf-stable items, things that come in cans or dry goods. And so if you want more information, I'm happy to share it here in the chat room. Thank you.
Yes, that'll be great if you could share that with us there, Jackie. Dr. Laura, you have your hand up.
Yeah, I just wanted to go back to something that actually Jacqueline mentioned, how much money these families are spending. And I think that that really brings up an important point of how extraordinarily expensive it is to be poor in this country, and how just paradoxically, the more money you make, the cheaper the cheaper functioning is. And I think that that's also a really important, of course, this is a much, much bigger issue, but it's a really important thing to address. And I think it was Dr. Sharon who brought up capitalism earlier. And it's something that we all need to be talking about on a regular basis, that we have structured the country to be like this. This is what we have made it to be. And so going back to what you guys were saying earlier about what actions to take, advocacy and voting are two of the biggest actions that people can take. Thanks.
Dr. Sharon?
This is another question. You know, I'm always asking questions here. I mean, you guys, several of you mentioned voting. How do you deal with the Electoral College around these issues when we can all go out and vote, but we have a problem? Okay, and I know, Jason, you mentioned it as well. And I think that, how do we deal with that? Because
can we actually go out and vote? I mean, if there's a pandemic and a big percentage of our population are vulnerable, can they go into a crowding polling booth to put themselves at risk? I mean, I know in a lot of other places around the world, people put themselves into harm's way to participate in their democracy. You know, I think the Electoral College is a great question. I mean, Sharon, you asked the best questions. Each question you ask really deserves its own UCSB major.
Well, thank you.
I'm sorry, Luis, can I just jump right back in here? Because the one thing that really struck me was back when Michael, you had said that the testing distribution in Houston was divided along racial lines. And my first thought was, oh my God, they probably put it where the voting booths were. And Sharon, when you said, you know, we can go out and vote, no, a lot of people can't go out and vote. You're absolutely right about that. And that's another thing that needs to change. Sorry, rant over.
Okay, if there is nothing else to add to that question, I'll move on to this next question. This next question is more student-oriented. I myself can sort of relate to a lot of the things that were talked about in this panel so far. I live in South Central LA, which is historically known as a food desert. So coming back here from living in UCSB for the entire academic year is a big change. So I guess the question is, the health disparities that these groups encounter increase their risk of facing complications due to COVID-19. How can students in these communities assure that they and their families are being safe and healthy during the pandemic?
I'm not saying anything. That's a heavy question.
I don't think they can. And I think the system is rigged against them. And I think that's part of what we're discussing here. That when you're talking about densely populated, low-income communities that are vulnerable, who have inadequate access to healthcare and have a higher incidence of comorbidity that makes them more vulnerable to ending up in the ICU or dead. the system is for a variety of reasons that have been discussed here on this panel is rigged. I think to bring it back to Melissa's solution mindset, I think that some of the solutions are like Melissa and Laura have said is education. I get a lot of students in my seminar that are pre-med, that are STEM students, and they're like, I want to study, I want to create vaccines, I want to be a surgeon, I want to be the Surgeon General, I want to wipe out disease. And I say, that's great. You also need to study philosophy. You need to understand distributive justice, medical ethics. You also need to study history. You have to understand all of these themes that Mario talked about the history of racial injustice and systemic exploitation of people of ethnic minorities. You also have to understand the power of narrative. You have to be able to recognize that a lot of people, both individuals and communities, have a powerful story that really deserves a much bigger microphone than society has given them. And I think the combination of science and the humanities is where those two roads meet is going to give some of the steps to solutions, because we need to be creative. We need to be creative with technology, but we also need to be creative in deconstructing some of these generations of structural violence and racism that have gotten us in this situation in the first place. Which brings us back, Louise, to your question about being in South Central. Gosh, I don't know what the immediate solution is, but I think the long-term solution, to borrow one of Jackie's terms, is going to have lots and lots of layers, is going to have a very interdisciplinary team from people with a lot of different backgrounds around the table, who are not just talking about what the initial emergency response is going to be, but what the 10, 20, 50-year recovery period is going to be, because it's going to take a lot to really undo the generations of harm that have been inflicted on some of these communities.
Thank you for that, Jason. We'll go to Dr. Ali, then Dr. Mario, and then Dr. Melissa.
So yes, I think while we're working towards solving the systemic problems, the virus is here now. And so I think for people, it's a matter of doing whatever you can to whatever extent you can. The basic philosophy, like Jason mentioned, is transmitted through droplets. So the more people are close to each other for a long period of time, less than 6 feet, longer than 10 minutes, the risk goes up. The other piece of that is how many new groups of people, people interact with. So if someone just sticks to their home core group, whether there's 2 people or 10 people, and they go to work and they're around the core work group, and beyond those 2 groups, they minimize that outing, grocery shopping, whatever is essential, that helps to reduce the risk. If they're out, keeping their mouth and nose covered helps to reduce the risk. If you can't do 6 feet of separation, do 3. If you can't do 3, do 1. Wash your hands. If you don't have a hand sanitizer, wash them with soap and water when you can. All these little tiny interventions can really be effective. And so, yes, on the big scale, yes, we need to address the big things. But for now, the best thing people can do is follow those established recommendations as best as you can, because every little bit counts.
Yeah, and I guess I'm just kind of piggybacking off of that. I mean, I think like Dr. Tediga and others mentioned, I don't know that complete safety is feasible, during this time. I think there's a lot of things that are happening, even outside of COVID, that we're dealing with as people of marginalized identities, as Black and Brown folks. So even if we could be safe from COVID, we're still dealing with being Black in America and not being able to jog or not being able to do, and so safety for me is it's a very triggering word during these times. I aspire to be safe. I aspire to support people in being safe. And I think like Dr. Ali said, well, first and foremost, I think to my earlier point, really making sure that the information we're getting out there is accurate. Dr. Tediga talked earlier about how there's so much misinformation out there. And misinformation is a complete turnoff, especially amongst people who are already skeptical about things related to their health and who that information is coming from. Not to mention all of the inconsistencies we have from our president and how that also creates confusion and concern and uncertainty about what we should be doing or shouldn't be doing to keep ourselves safe. But I do think being able to get accurate information that is communicated to individuals through trusted sources. I think about my own family and having a grandmother who's 91 years old. And, I'm blessed that she's been safe, and my 97-year-old grandfather have been safe. But there's a real skepticism there about doing some of the things like wearing masks. I mean, these are individuals who have lived through some of the worst atrocities known, to Black folks in America. And so I think there's that skepticism, and there's a real need for us to take it seriously. I think it's important to take it seriously. That's something that I try to communicate with my own family. Even if you're skeptical of the message, do your part in taking care of yourself. I think modeling appropriate, practices in these times, communicating with people, and really just trying to get the word out is going to be really, really important. Having accessible testing that people can get to, testing in places that people feel comfortable going is another thing that, can be done to maybe ensure safety. But it's a complicated issue, and there's a lot of systemic things that I think make complete safety something that's less than feasible during these times.
I was muted, sorry. We'll go with Melissa, and then we'll go with Sharon.
So I have a couple of thoughts. One is more at the downstream. What can students do in their individual communities to protect their families? One thought that I have, because I've been involved in the reopening collaboration with the County of Santa Barbara, and there are very strict guidelines that all employers are supposed to follow in order to be able to have people work for them. And so really having folks understand what those guidelines are and holding employers accountable so that they are providing the protective equipment that people need, that they are making sure that folks have education, that they're getting the spacing. And so that's something that people should be educating their family members that they can and should hold their employers accountable, learning that, and then supporting those efforts as students when you're back in your communities. I think it's like, a very specific, concrete downstream effort. And then I think we should really be thinking again about upstream structural change and how there's specific opportunities that the pandemic provides us that wouldn't happen otherwise. So people have been working to get toilets for farm workers in Santa Maria for years. And this is the first time that we can actually say, for a public health reason, everybody needs access to a toilet and hand washing. And this has been a struggle for years. Or even more radical, let's imagine the argument that farm workers are essential workers. And if they are, then we need to completely remove all barriers to their access to government services, whether or not they have legal status. So really to engage in those really important political fights for treating with respect all of our essential workers and removing those structural barriers. And I think these are unusual political openings and opportunities that we should all be taking advantage of.
Okay, I'm going to open my big mouth and say, in an ideal world, what we would have is the campus provide all the students with a PPE care packet. Okay, I mean, I think that should just be basic standard practice. That also has in that care packet have information in it, because one of the things that we assume is that every student has access to internet, to data, on their mobile phone. They don't. So a lot of students have lost that when they left campus. When they went back home, they didn't have that ability anymore to actually have the internet so they can access things. I'm dealing with it because I have a lot of students. So in the best of all worlds, I would say providing them with a lot of information, as Melissa and others have stated, and Mario has stated as well. I think we need to do the testing and contact tracing. You know, even though some people are opposed to that, we know that. I've heard many people saying that they don't want it, you know, because of Big Brother watching, but Big Brother is watching us anyway, whether we know it or not. We have a lot of socio-technical abilities that we didn't have before, and that we should be able to use those abilities just to help students get the information even back to their parents, and having it as a part of orientation. And also, I know we have a capacity issue, but we're gonna have to deal with grief. I've had students that lost family members, you know, to COVID-19. I've lost two of my family members to it. I know weren't really close, but I have lost family members to it. And I think knowing that what I've seen with my students around just the grief and anxiety that they're dealing with, we have to have that in place before we move students back to campus. And we just can't throw them in the dorms and say everything's gonna be okay. I listened to another webinar this morning from UW and Arizona State, and I think it was Purdue. They were talking about they're phasing in and the different models that they're gonna be using, online versus hybrid versus face-to-face. And, you know, they have some strategies in place that I think that we can all benefit from. And I don't know if all the chancellors and presidents across the AAU universities anyway, if they're talking with each other about this, you know, some of the phase-in planning that they're going to do. But another thing I know, contact tracing testing is very expensive. I understand that we've got some abilities to do it, but it's too expensive. And I understand on campus, we're also trying to develop something. So I think that we need to try to figure out how we're going to deal with students. That's how you're going to keep them safe. You really have to have that testing and contact tracing. You have to have the information. You have to provide them with grief counseling. You have to provide them with any type of intervention around the psychological, you know, things that they might address. And realizing that we don't have the capacity, but I think that's what we need to ask for on campus when we go back. Even anxiety for faculty that are worried about coming back to campus and being exposed. So these are something, because that affects students as well, right? So all of these things will affect students. And I think that hopefully through that process, we can have at least a little bit better environment.
Thank you for that. We'll go to Dr. Barfield, then Maka, and then we'll move on to Q&A.
Yeah, I was just going to, again, piggyback on one other thing I thought about as a psychologist, just the importance, and again, Dr. Tediga and a few others have mentioned this, just the importance of mental health. You know, at CAPS on campus, obviously we're virtual now, and not sure what that's going to look like we'll have some idea for fall, but not completely sure. But just taking care of our mental health, I think in the Black community and in many communities of color, mental health is highly stigmatized, right? We don't do a lot of talking about our health, whether it be our physical health, but especially our mental health, you know? And so being able to have conversations, checking in with people, having authentic conversations about how we're actually doing, and taking it below the surface and really kind of getting in to what's going on for us, even if there aren't solutions for it. I think there's something to be said about being able to process what you're feeling, what you're going through, being able to reach out for support. There's a normalcy to knowing that you're not alone in your struggles. And so I think being able to kind of have access to mental health resources. I know at CAPS, we're constantly thinking about how we can be of service to students during these difficult times. And we're ready and willing to receive you all, no matter how fall quarter rolls out. And so just really, really encouraging students, you know, it's trying times, and there's a lot of uncertainty, and there's a lot more questions than answers. But being able to come in or being able to have some sort of space, virtual or otherwise, where these things can be talked about, you can feel validated, and accurate information in terms of mental health and ways of coping can be something that's communicated to you, I think is also something really important. And then hopefully that information can be information that students take home to their families to continue to try to challenge us as a community to have more intentional conversations around our mental health.
Can I just say something right quick? I don't know if the campus, if it's possible, especially since we have these social technologies, to actually bring in family members with their students and have these sessions if they have the technology available. That might be something we could do.
I wanted to say that one of the things that when we're talking to students, they said, you know, it's nice that you have these things available to us, but if we can bring that to them directly, instead of them having to come to us, and finding ways to do that can be something that's a huge challenge, but something to consider. And then one thing I just wanted to say about, I listen to all this stuff and it can get kind of depressing and overwhelming. And I just want to have a little, if any students are for the students who are on here, just to remind that there is hope, right? So we have to address this on the downstream and the upstream, but one of the things to think about is, as Dr. Jason was saying, is the stories that we tell. And so there's sort of like 3 stories that we can tell each other. We can say that that it's just this business as usual and we just go about our own business. This doesn't affect me, but we know 100,000 people have died, right? No one's going to be untouched by this. 100,000 in America, right? So we're all going to be touched by this. So I don't think that's a sustainable story that we can tell ourselves. The other story we can tell ourselves is that this is overwhelming and there's nothing I can do just because I'm just one individual. It's too big, right? Systemic racism is too big, or all these things that we're talking about. And lose hope. And I'm sure we fluctuate from all these stories, right? Depending on where we are during our day. But the third story we can tell ourselves is like, this is the point in history, you know, 1,000 years from now, where people look back and they said, remember when COVID-19 happened in our community? And that is when things changed, right? That is when our farmers got toilets, as you said, right? That is when people started working together to solve these issues. And we don't know what the future is going to hold. You know, it may be horrible and there's going to be horrible stuff too. But again, we cannot predict what it can be. So why not also think about, well, the possibility is possible, right? That this is the turning point where 7 generations from now, people look back and say like, wow, that is where things started to change. And then what we do today matters, right? From the smallest thing to the biggest thing. But as we go forward, let's do what we can to contribute to that possibility.
We go to Jackie, then Jason.
Thanks for sharing the concept of hope, Maka. You read my mind. I was very much on that train of thought. And one thing that I wanted to also just second is the concept of being proactive. I do see that we have an incredible plethora of resources for our students, different centers, different locations. But I think that this is really the time, especially once the students are back on campus, is to put our heads together and try to work together to actively go out there. And then ideally, if we can support the resources that are getting inundated, for example, Mario, I know you mentioned CAPS is doing so much. Well, there's only so much that you all can do. You know, I mean, you're an incredible big team, but thinking about any way that other resources can support you so that the efforts are streamlined and we're working effectively and efficiently, I think that would be really wonderful. And I'm sure that many people would be receptive to that. So yeah, that's all I just wanted to say is that at least on my end, and I know on Health and Wellness, we are definitely pro doing everything we can for students' well-being and to support them through all of this.
Jason?
Yeah, so I'm so glad that Mario and Michael and Jackie made those comments, and I in thinking about this, the hammer and the dance, we're the dance part, and we don't know what a lot of these solutions are going to look like. We're really in very uncertain times, but we've been in uncertain times before, and I think I really want to emphasize what Michael said is that we are in this together, and that the communities that do well are the communities that do this together. And I want to emphasize to the students that you have Mario and his extraordinary team as a resource to you, but you also have each other. And though you're physically distanced, you, much better than I, have all kinds of extraordinary resources to be socially connected, and that this is a shared experience, and that the shared experience can be used as a tool to help give you agency and to help combat some of the stress and mental health, and potential mental illness that this can cause. And also that you as students have an extraordinary panel of mentors here that run the gambit of clinical medicine, psychology, Black studies, Latinx studies, that you have people on campus that can help you foster the tools that you need to figure out what the next step of the dance is going to be and what's going to be the step forward. Because I know what I'm doing in the emergency department and with public health looks differently than what Mario's doing with mental health, which looks different than what Sharon's doing with advocacy in the African American community. We all play our part, and all of our parts are so essential. And I guess to the students, my question for you is what part are you going to play? What legacy you're going to leave when you talk to your children and grandchildren and they say, where were you during the great pandemic of 2020? That was a pivotal moment in our world history. Then you can say with pride, well, you know what? This is what I did, and this is the hill that I took my stand on, and it mattered. And for you, I don't know what that looks like, but I certainly hope you find what that is, and that you make a difference and do your part.
Thank you for that, Jason. Melissa?
I would just like to build on what Jason just said and say that I really want to encourage folks to as a way of kind of dealing with some of the paralysis that we all can feel when this is so overwhelming, is to get involved in different ways to contribute to work going on here in the county. And again, to resend that link and invitation to folks to let us know if you're interested in collaborating this summer or this fall. The group that is working on this now in the Center for Publicly Engaged Scholarship is a really wonderful collaboration between graduate students, undergraduates, faculty, staff, all contributing in really profound ways to the health equity work. And we need more talent, we need more ideas, and I think it has been really gratifying for everybody, and people are making a real impact. So just encourage you all to let us know if you want to be involved.
Thank you for that, Melissa. Sort of building on top of that, we are nearing the end of the town hall, and I do want to be mindful of panelists' times. We do have 2 Q&A questions, which Jane will go over, but if you do need to go, we are understanding of that. And I'd just like to thank all of you for contributing to this conversation today. It's very important and needed, especially within the UCSB community. And to any student that is interested, again, I will drop the link for you to sign up and continue this conversation further in the fall. And yeah, thank you for that. Jane?
So some of you talked about like UCSB and education systems being accountable, like offering PPE packages and like making resources like accessible to students. So someone had a question about harassment or discrimination that minority or people of color or students of color will experience when the new school year arrives. Is the school ready to address these issues? They worry that students are afraid to speak up about what they might have experienced.
I think I'll just say something. I think that is a tough one as well, because you have the power dynamics, right? And people wanting to not really address the issues. I've seen that consistently at UCSB campus. It's a type of silencing that is just amazing. And I've been to multiple institutions, and I can say that I've never seen it in such a way where students were afraid or people are in denial about what's going on campus. Because I've had a lot of students that came to me in tears about various things that's happening to them across campus. And I think that we all have to be, I think some of you mentioned that, we all have to provide that kind of resource for students where they feel comfortable, where they can connect to someone, and then we become the advocates for them when they're in those situations. That's what I can say. And I try to speak up every time. And sometimes people think I'm too direct, but I don't know any other way to say it, other than just saying it, because that's the problem that we've had, is not being able to feel like we can't say things that are the truth. And as someone once said to me, I mean, more recently, I won't mention it, but on campus, they said, it's almost like having that sense of integrity, just to be honest about things that you're seeing that's going on with students and the kind of oppression and the things that happen to a lot of students on our campus. And I think it is time that we open ourselves up to be able to hear what students have to say and then take that to higher administration. We're in the process of hiring a vice chancellor of diversity. And I think that these are some of the issues that need to be addressed.
I'm just going to jump in on two things that Sharon said. Is first of all, Sharon, can I be your friend? You're just extraordinary.
Well, thank you, Jason. I appreciate you so much.
And the second reply to Jane's really provocative question, and this is, most of my work is as a clinician. I see patients. I work with public health and the fire department. I teach some classes at UCSB, so I'm not authorized to speak on behalf of UCSB. But I'm gonna put myself out on a limb to say this when you ask the question. First, incoming students who feel the discriminatory vice of racial discrimination, what's UCSB going to do? I don't know, but I feel like like Sharon said, there is a collective responsibility and we all have ownership, and any faculty should be able to provide a welcoming door for any student of any background to walk into and give them a voice and give them a structural pathway so that any discrimination can be addressed systemically. And if we're not doing that, shame on us, we should be. And I see Sharon nodding her head, and her validation is all I need, because I think that we are one of the best institutions in the world, and I really believe that. And any student who is going to be a future leader in society who comes through UCSB should be able to walk into any faculty door and say, something, someone made me feel inferior because I am who I am. And we should have that door open, and we should close that door behind them and say, something, tell me how I can be a resource to you. So if we're not doing it, we should be. That's the only comment I have to that. I unfortunately have to go relieve a babysitter, but I'm going to send my email to all of the attendees. And if there's any way I can ever be a resource to you, please let me know.
Thank you so much, Jason. Dr. Ali?
Yes, so if the question is, as the campus is planning what fall is going to look like, is there specific attention to addressing potential racial-related incidents, harassment, violence? I'm not sure if that's on that grand scheme and agenda on any campus for that matter, and I don't think our campus is any different. If we look at our track record on our campus in the past of dealing with race relations on campus and sexual assault and gender inequality, it's not exactly stellar, but is, like so many have said, is this an opportunity for a change? To be fair, student feedback really works. It gets a lot of traction. So if students are willing to write to whoever you can and say, hey, as you're planning for the fall, I want you to address the racial issues that'll come up with it and address racial harassment and violence and all that, that will help to bring it to the forefront and get some traction on it.
Thank you. We're going to move on to another question. On the topic of misinformation, how can we as a community better inform people of the difference between falsely released information and changing conditions based on new data? We'll start with Dr. Ali and then Melissa and then Dr. Laura.
So there's a lot of facets to this, but the one part that I will want to speak to is this virus is new to people specifically. And so because it is new, because it's contagious and it's deadly, we're trying to learn as much of it as we can about it as we can, as quickly as we can. So what that means is a lot of times you're going to see a lot of information or study or research come out without peer review, so to speak, meaning that other scientists look at the study to see was it done correctly, is it appropriate, can we really rely on these conclusions, and then put that in the broader context. And so in the pressure to get information out, a lot of news outlets will just put a study out there and put a headline that really captures your attention. Like, I don't know, COVID found on surfaces 3 weeks later. But then the context really breaks it down that it was a lab and it was just taking DNA. That doesn't mean it's infectious and it was on a specific surface. So what I tell everybody is you're going to hear a lot from different sources. Social media certainly feeds into that. There's people who tell stories. There's people who have personal stories on YouTube about how they as an individual went through COVID, and there's a video of somebody slapping their chest because they're knocking the mucus loose. Okay. Keep in mind that's an individual's experience, doesn't mean that's how you deal with the issue. And really rely on those vetted, trusted sources. Again, for what it's worth, the CDC, California Department of Public Health, Santa Barbara County Department of Public Health, those are probably our most reliable sources of providing that context.
Thank you, Dr. Ali. Unfortunately, Melissa had to leave, but Laura, will move on to you.
Yeah, this is an excellent question. And, I think we've been kind of dealing with the issue of false information and misinformation all night. I think that this also can be an educational opportunity for us. The art of reading a medical study is a challenge. It really is, to be able to tell, is it a valid study that was adequately powered, and was it designed correctly? And like Ali said, a lot of this is brand new and none of it's been peer reviewed, which is a really, really important step in the process to get something published. Because you do need somebody, a peer that's outside, to look at it. All that said, we are in an educational institution where a lot of this research is going on. And we have research scientists sitting here in this Zoom room. Dr. Sharon is, I'm going to offer you up as a resource, but, obviously has interpreted many, many studies. And, there's a student health office full of physicians, and it's always okay to pull somebody aside and ask. And say, hey, look at this study. This is what I said. Is it legitimate? Is this solid science, or do I need to keep looking? And once again, I think we're lucky to be in this educational environment.
Sharon, go ahead.
I was just going to say, I'm going to have to leave, but I want to thank everyone on this panel. All of you have been absolutely amazing. And Luis and Arzu and Jane, I just sent something out. If you guys could send people's information out, if they're willing to share, then that way maybe we can start something from here, right? I mean, the things that we've talked about, let's kind of take a little bit of action on it in some way or another, even if it means just how do we get this information out? That could be a strategy within the county, within the university. Just, what are some of the ways we can just make it simple and easy to read, right? So I want to thank all of you, Laura, Mario, Ali, Jane, Luis, and Arzu, and everybody else who left, because I'm going to have to go myself. But thank you all so much. I appreciate it. It was great. I enjoyed it a lot. Take care. Bye-bye.
Hey, Sharon.
Thank you, Sharon. Just to be mindful of everybody's time, we had one more question, but if y'all have to leave, it is fine. We can always continue this conversation on a later date. I just want to thank everybody for attending and contributing to this conversation, especially to all of our panelists, Mario and Ali, the ones that are left so far, but to everybody that contributed, just a big thank you. And as far as the next steps, we hope to continue this conversation and, just like Sharon said, implement this into some form of action. So thank you on that note.
Thank you.
Thank you for having us. Thank you for putting this on. That was great. Bye, everybody. Good night.
Good night.